a general survey. I'm observing the environment of my patient's room, that there's no hazards to myself or to my patient. I'm also observing my patient, that he looks to be awake, alert. He does not appear in any distress. He's not tripoding. He's not using accessory muscles. His skin is normal for ethnicity. I don't hear anything that indicates he's in distress, so I'm going to go ahead and enter the room, knock and enter the room, and begin my assessment as planned. So knock, knock, knock. Hi, good afternoon, Mr. Power. My name is Kristen, and I'm a student nurse at Palm Beach Atlantic University, and I'm here today to do a full head-to-toe assessment on you. Before I begin, I'm just going to provide us some privacy and wash my hands. Would you mind if I check your ID bracelet, please? State your name for me.
Norman Power.
And date of birth.
4/20/1999.
Fantastic. Thank you, Mr. Power. Mr. Power, can you tell me where you are today?
I'm in the hospital.
All right, and what brings you in today?
Knee problems.
Okay. Oh, sorry to hear that. And do you have any, excuse me, can you tell me what year it is?
2020.
Fantastic. So my patient is awake, alert, and oriented ×4. Now, do you have any pain?
No.
No. If you did have pain, then I would go through OPQRST. Do you have any questions for me before I begin?
No.
Okay. I'm going to start the assessment today with a quick memory recall. So I'm going to give you 3 words. Say them back to me, and then later in the exam, I'll ask you to recall them. All right. So how about cup?
Cup.
Bat.
Bat.
Ball.
Ball.
Cup, bat, ball.
Cup. Bat. Ball.
All right, very good. All right, keep those in the back of your mind. I'm going to now start with your head, scalp, and skin. Is it okay if I touch your scalp?
Yeah.
All right, so I'm going to assess my patient's scalp. I'm palpating for any lumps that I may find, lesions, looking at the hygiene of my patient's scalp. He appears well groomed. I don't notice any lumps, lesions, or issues with his skin integrity. Also looking at the occiput for nits. I don't see any. While there, I'm also checking for any signs of early skin breakdown, like non-blanchable redness at the occiput, the shoulders, the scapula, the sacrum, the elbows, and the heels. I do not see any non-blanchable redness. I'm going to check your skin for warmth and dryness on the upper extremities and lower extremities. His skin is warm and dry, and the capillary flow of the toes is within normal range, less than 3 seconds. Checking for edema, which I do not feel or see. On the fingertips, again checking capillary refill on both hands is less than 2 seconds. Very good. Pointer fingers to make a small diamond. The diamond is present, which is a negative finding for clubbing. And skin turgor, checking for tenting. And I do not see any tenting. The skin is elastic and snaps right back, which indicates he has good elasticity and is well hydrated. Do you have any moles that you're concerned about?
Oh, yeah, I have one right here. No, we're not doing that?
Nope.
No.
Okay, if you did, then he'd go through A, B, C, D, E, 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 F, G. All right, very good. So I'm going to go ahead on, and I'm going to start with your eyes, ears, nose, and throat. Starting first with the eyes, I'm inspecting the eyes. I notice that the sclera are white, the conjunctiva are clear. I don't see any redness. I don't see any drainage coming from the eyes. Do you wear glasses or contacts?
No.
All right, very good. Do you have any eye complaints today? Very good. All right, so I'm going to start by assessing cranial nerve number 2, which is the optic nerve, which is vision. Starting with the Snellen chart, I'll stay here. Can you cover one eye for me? And about 12 to 16 inches from his face, read the lowest line you can.
4, 2, 6, 7, 3, 9.
Very good, and switch to the other eye. If it's the same line, read it backwards.
9, 3, 7, 6, 2, 4.
Excellent, he has perfect 20/20 vision in both eyes. Next is peripheral vision. Again, just look forward and cover one eye again. If you'll add up the fingers that I'm holding up.
4, 2,
Switch eyes.
3, 4.
Excellent. Cranial nerve number 2, optic, is intact. Next is cranial nerves numbers 3, 4, and 6, which is oculomotor, trochlear, and abducens. This is eye movements. First is the big H. So again, you'll just continue to look forward and follow my finger. Yep. And when I'm doing this, I'm looking at the cardinal fields of gaze to make sure he has full range of motion of his eyes, and also that his eyes don't quiver, which is called nystagmus, which I do not see. Fantastic. Next is pupillary constriction. Just look forward. I'm looking, I notice that his pupils are round and equal in size. Now looking that his eye directly constricts to light and then consensually constricts to light. Very good. And then on the other side. And then again, consensual. Now looking here. The light's in your eye, I can't even tell. We'll say that it is. And then last, follow my finger in. All right, that's accommodation. Eyes straight forward. The pen light is, I think, dying is part of the problem. There we go. And the light reflects in the same part of the pupil on both eyes. So we can say that his eyes are equal, round, reactive to light, and accommodation. All right, last on the eyes, before we move on, the eyes take a while, is the red reflex. I'm just making sure that I can see through his pupil to the retina. My right eye assesses his right eye. And excellent, I see the red reflex there. And again, that the red reflex is present. So red reflex present in both eyes. Next, moving on to the ears. Inspecting the ears, that the cartilage of the ear is not red, inflamed. I don't see any keloids or anything on his ears. Does this cause you any tenderness?
No.
I also see there's not any drainage coming out of his ears. Any tenderness?
No.
Good. And his ears appear about equal with the corners of his eyes, which is a normal finding. Cranial nerve number 8 is vestibulocochlear, which is the whisper test for gross hearing. I'll say a word if you could just recite it back to me. Cover that ear.
Hospital. Banana.
Excellent. Cranial nerve number 8 is intact. Very last thing for the ears is inspecting the external auditory canal and the tympanic membrane. The EAC should be non-inflamed and not red, and the tympanic membrane should be pearly gray and concave. Pulling the ear up and back. And we are pearly gray. I actually can't visualize that one very well. Got some wax in there. Okay, so we're going to go ahead and say that those are normal findings and move on to the nose. For the nose, you don't actually have to do, so you just speak it out. The cranial nerve for the nose is olfactory, which is number 1. You would have the patient close their eyes, occlude one nostril, smell something non-irritating and identify it, and then switch nostrils. Inspection of the nose would be that the septum is midline, that the turbinates are not boggy. Do you have any complaints with your nose?
No.
And there's no drainage coming out of his nose. So that would pretty much complete the nose assessment. Sinuses, let me know if you have any pain here on the frontal sinus. And how about here?
Nope.
Maxillary sinus. Excellent. All right, so moving on to the mouth. Inspection of the mouth would include looking at the dentition, the tongue, the gums, looking to see if there's any abscesses, if there's any abnormal coating on the tongue. When he sticks his tongue out, that it comes out midline as part of the cranial nerve assessment, 9, 10, and 12, glossopharyngeal, vagus, and hypoglossal. Also looking that the uvula and the palate rise symmetrically. Can you say light, tight, dynamite?
Light, tight, dynamite.
Fantastic. So those cranial nerves are intact. I believe that includes the mouth assessment. All right, so EENT is finished. We're going to move on to the head, neck, and lymph nodes. For the head and neck, I noticed that the trachea is midline. It's not deviated to the left or to the right. The thyroid, if you'll look to the right for me, I'm going to palpate the left side of the thyroid for nodules, which I don't feel. And then to the other side, again, the same thing, which I do not feel. I'll also feel the thyroid from behind. I'm not going to choke you, so just very quickly I'm going to have you swallow for me and feel the thyroid rise and fall. Excellent, which I felt. I do not feel any nodules there. For the lymph nodes, starting with preauricular in front of the ears, using my finger pads to feel for any enlarged lymph